UBC's midwifery program in the Department of Family Practice within the Faculty of Medicine. Today, I am joined by Christy Newton, my TBC at UBC Network co-facilitator. She is the Associate Vice President, Health, and also Associate Professor in the Department of Family Practice in the Faculty of Medicine at UBC. Thank you for joining our network event today. Before we begin, I would like to acknowledge that the UBC Vancouver Point Grey campus is located on the traditional, ancestral, and unceded territory of the Musqueam people, and the UBC Okanagan campus is located on the traditional, ancestral, and unceded territory of the Syilx Okanagan Nation. I would also like to recognize that UBC's activities take place on Indigenous lands throughout British Columbia and beyond, and that you are joining us today from many places. I acknowledge the traditional owners and caretakers of those lands, and I am attending from Musqueam, Squamish, and Tsleil-Waututh territory. Please share the land you're joining from in the chat if you wish.
Thanks for that opening, Lee. I am joining from Semamit, the unceded shared territories of the Tsleil-Waututh, Musqueam, Squamish, Coquitlam, Qayqayt, Katzie, and Stolo nations. Again, thank you all for joining this TBC at UBC Network event today. I'm quite excited. As you can see, I've been trying to hold back my smile. So just a bit about the TBC at UBC Network. It is supported by UBC Health, which works under the Office of the Vice President Health. And the role of UBC Health is to facilitate and enable collaborations across disciplines, faculties, external health sector partners, and communities to improve the ways we train people, develop knowledge, and shape policy, ultimately to address inequities and improve the systems that foster and support health. The TBC at UBC Network convenes health professionals and leaders, patients and caregivers, community members, academics, and policymakers to bring forward questions and ideas important for team-based care in British Columbia. The network aims to support and complement province-wide efforts to enhance team-based care in British Columbia by focusing on education, research, evaluation, and knowledge translation, and by enabling participants to learn from each other and connect their efforts to help address the complex challenges affecting health and well-being today. And so I am so excited. Let's get the network going.
Thanks, Christy. As we often start, we'd like to start with two poll questions just to get a sense of who's in the room with us today, who's joining us today, and what you hope to gain from this session. Please take a moment. I think they're going to come up on screen in just a moment. And please take a moment to submit your responses. We will take a look at the results together. Both of the questions appear in one poll. You may need to scroll down to see them both. And we're just waiting for the results to come up as soon as everybody's done. Excellent. Thanks, Jen. So looking at perspectives, it looks like we have a wide kind of break of the perspectives across the different groups. Lots of UBC faculty and staff, as well as health professionals, health administrators, And then community members, students, and researchers also joining us. And looks like the highest kind of winner of the what you hope to gain is learning and knowledge sharing, but also to find inspiration and build professional connections, collaborate and connect with peers, and explore resources. I appreciate that everybody took the time to do that. Thank you. So today's session focuses on the new Gateway Team-Based Care Teaching Clinic opening on the UBC Vancouver campus. Envisioned as a provincial resource, the clinic will provide longitudinal primary care to Vancouver residents while serving as a hub for collaborative education, research, and innovation in team-based care. We'll explore how roles, scopes of practice, and workflows are intentionally designed to support patient-centered, team-based care, and how interprofessional education, research, and quality improvement are embedded directly in the day-to-day clinical work. We'll use Zoom and Slido to gather reflections throughout the session. Only the word cloud will be displayed live, and the remaining questions are anonymous and help us understand what's resonating and how we can improve future sessions. In terms of how our session today will be structured, it's a little bit different than often with our TBC at UBC Network events. We're going to begin with a brief overview of the Gateway Clinic vision and goals from Julie Tipping. We'll then move into 2 rounds of 20-minute breakout discussions. This format is what's a bit different. You'll have the opportunity to choose 2 of 3 themed groups based on your interests. And we're using the full 90 minutes today to allow for deeper and more focused conversation. Each breakout will include a short framing presentation followed by a facilitated discussion, and then we will close by reconvening to share key takeaways from each room. And with that, Julie, I'll hand over to you for your presentation.
Thanks, Lee.
Thank you.
Hi, everybody. Thank you very much for taking the time to join us today. My name is Julie Tipping. I am an assistant professor in the School of Nursing here at UBC on the Vancouver campus, but I'm also the program director for the Gateway Team-Based Care Teaching Clinic. So I'm very excited to share what we have been working on regarding the clinic with you all. Many of you work in primary care every day, and you understand the rewards and the pressures of our system. I wanted to introduce the Gateway Team-Based Teaching Clinic to you today. This clinic is designed as a real-world primary care clinic. It is not a theoretical model or a simulated environment. It is a functioning clinic intentionally designed to integrate 3 things that are often separated in practice, those being patient care, clinical education, and systems learning. The goal is to explore how we can deliver high-quality primary care while also preparing the next generation of healthcare professionals to work effectively in team-based environments. Next slide, please, Jen. So the starting point for the Gateway Clinic is really a shared reality many of us experience in primary care. The patient needs are becoming more complex. Care is often remained fragmented across providers and sectors. Teaching is frequently layered on top of already stretched clinical work, rather than integrating into it, and workforce sustainability is an increasing concern across many disciplines. At the same time, we know that the future of primary care depends on strong interprofessional teams. Yet many learners still graduate without having truly experienced how team-based care functions in daily practice. The Gateway Clinic was created to respond directly to these realities. The intention is to build a clinic where collaboration, supervision, and learning are parts of routine care, rather than additional tasks added into the clinical workload. Next slide, please, Jen. So the vision of the Gateway extends beyond a single clinic. The aim is to support high-functioning primary care teams across British Columbia by intentionally training healthcare professionals to work collaboratively. The ultimate goal is to improve patient outcomes, better provider experiences, and a more sustainable care model. Gateway Clinic is therefore designed as a provincial demonstration site. It is a place where new approaches to team-based care and interprofessional education can be tested in real clinical practice and then shared across the system. The next slide, the mission for the Gateway Clinic focuses on 3 priorities. The first is building a strong competencies in collaborative practice for learners across multiple professions. The second is increasing placement capacity for healthcare professional students in primary care settings. And thirdly is to develop and evaluate sustainable models for team-based care that can inform system transformation. In practical terms, the clinic exists to do the work, test ideas, learn from what happens in practice, and share those lessons with the broader system. Next slide, please, Jen. So many conversations about team-based care focus on ideals, but Gateway focuses on design decisions. Team-based care is at the core of the operating model, rather than something added on top of an individual practice. All of the clinical members are salaried at this clinic. This helps to reduce productivity pressures and traditional hierarchies that sometimes can make collaboration more difficult. Patients are treated as active partners in care, not simply recipients of care. Teaching and supervision and quality improvement are built directly into clinical workflows. The intention is to design a system that supports collaboration structurally rather than relying solely on individuals' goodwill or effort. Next slide, please. In a day-to-day practice, patients may be seen by multiple professions during the same encounter or through coordinated team interactions. Care planning reflects the combined scopes of practice of the team rather than a sequence of separated referrals or handoffs. There is protected time within the clinical workflows for reflection, teaching, and supervision, and there's an emphasis placed on continuity, prevention, and the whole person care. Importantly, the goal is not slower care. The goal is better coordinated care with less duplication and less cognitive load on individual clinicians. A central frame and a central feature of the Gateway Clinic is the integration of learners into everyday care. Learners are treated as active members of the care team rather than observers. Supervision happens in real time as part of the clinical work. Teaching is shared across professions rather than isolated within individual disciplines. Feedback becomes continuously because it is tied directly into patient care activities. Over time, the aspiration is to involve patients more actively in the teaching and feedback, recognizing the important perspective that patients bring to the learning process. Next slide, thanks. Collaboration does not happen automatically. It is not simple because professions work in the same building. In the Gateway model, roles and scopes of practice are made explicit and visible. Decision-making is shared. Hierarchies are intentionally flattened where possible. Psychological safety is treated as a patient safety issue. When team members feel safe to ask questions or challenge decisions, care quality improves. Role overlap is viewed as a safety net rather than an inefficiency, while still examining workflows carefully to avoid unnecessarily duplications. The goal is that collaboration becomes something people practice every day rather than a concept discussed or a theory. The next slide, yeah. Gateway sits within a broader partnership environment. The initiative was convened through UBC Health and aligns with education, research, and health system priorities. The clinic brings together multiple health professions, patients, academic partners, and system interest holders. It is intentionally structured as a learning health system, meaning that evaluation and quality improvement are embedded within the clinic from the start. Clinical practice, education, and systems learning are designed to inform one another. So you might be asking why this matters to you. So for many clinicians, the most important question is the practical relevance. Gateway Clinic aims to contribute to a more sustainable model of clinical practice. This includes clear role definition, reduced duplication of work, and meaningful ways to participate in teaching without adding excessive workloads. It also provides an opportunity for clinicians to shape how team-based primary care evolves in British Columbia. The clinic is not intended to only represent a perfect model. Instead, it is meant to be a place where we can collectively explore what actually works in practice. Thank you, everybody.
Thanks, Julie. That was great. We have lots of team-based care models rolling out across the province. However, um, I think we all recognize that it's not, they really haven't caught on. They haven't achieved the ultimate efficiencies and quality that we've hoped. Some of them have. There's quite a spectrum, and we're just trying to figure out why. And I think this is our opportunity at Gateway to really look at how we can tinker with the models that exist in team-based care, practice education, quality improvement, system innovation, workflows to really harness the efficiencies that we're hoping to gain from these team-based care models. So enough about that. We are going to head into the breakout rooms for our discussions. And as Lee said, we're doing them a little differently today. There are going to be three themes. One is evaluation and research, two is education, and three is practice innovation. And we're going to have two rounds. So you can choose the first one that best aligns with your interests. One thing is, though, that we have over 100 people attending today. So if you get to the first breakout session and there are well over 30 people, 40 people there, maybe choose your second choice and then go back for the second round to that one. And we'll see if we can balance everybody out in the three breakout rooms. The way you join is the rooms will appear and you can click join for your chosen room. Again, one is evaluation and research, two is education, and three is practice and innovation. Each one will be about 20 minutes. Each one will have a short framing presentation and then facilitated discussion. The breakout rooms are not recorded. However, the facilitators will help guide the conversation, and we really do encourage you to participate, to engage by asking questions. And then after both rounds, we're going to reconvene as a large group and share some key takeaways from each of the rooms. If you have any trouble joining a room, just stay in the main room and we'll be able to get you sorted into a breakout room. So off we go.
Welcome back, everybody. I feel so inspired by the many thoughtful and innovative ideas shared in the groups that I joined. And simultaneously, I'm reminded how grateful I am for the energy and passion for this work and for the great work that's happening around the province. I think we've got about 15, 20 minutes together left, and we'd like to hear from the facilitators from each of the breakout rooms, just to briefly share a few key highlights from their discussions, and then we'll move into kind of an all-group conversation and look at the word cloud. Do we want to go in order of the rooms for the facilitators? Does that sound okay?
Surely. What's the order? Am I first?
Let me find the room organization.
Yes, you're
I
first.
think, yeah, you are, Teal.
Okay, awesome. So yeah, I'll try to sum this up quickly. We had some really great discussion. I think one thing that came out in the discussion around evaluation and research was just recognizing how much amazing work is already happening across the province. And so people were very generous with suggestions of who potential collaborators might be in all aspects of the work, whether it's, quality improvement, evaluation, research, sharing tools, sharing insights. So I think we got some really great suggestions about how we can be a little bit more networked and in tune with each other, which was awesome. I think we also had some really great suggestions around how we can make sure that the patient's voice is present in the evaluation and research work, and really needing to find meaningful ways for involvement that go beyond just being subjects in the research at the clinic. And so I think that, that's a really important reminder, and something that we've been committed to in terms of involving folks in the groups that are leading the development of this. So really having longitudinal patient partnership from the outset. And I think there were also a lot of thoughts around how we actually operationalize this embedded research structure, and some really great ideas about, models of having learning dyads or partnership, how we can bring people who aren't necessarily directly focused on research in, and have them be immersed in that embedded environment. And also, I think, just making sure with the evaluation work that we're really aligned with what's already happening provincially. So lots of great thoughts, lots of great ideas, and looking forward to kind of digging into the notes that I took from the session and figuring out how we can incorporate it in what we're developing.
Thanks, Tio. And I think the education group is second.
Yes, and so Carrie, Kelly, feel free to chime in. I can get us started. I think what we heard in the education group, just around the existing challenges and barriers around regulatory standards, and what that might be like around cross supervision of learners, understanding of different people's and professions' scopes of practice, and for individuals to be working to top of scope and the limits that might exist within that. And we talked a little bit about the culture change that we might have to foster as part of the onboarding, to really be able to impress upon this way of working that might be different from the typical practice, and to be able to address some of those issues in real time. We also talked about in what we're putting together. I think this is applicable across the education, research, and evaluation, as well as the kind of practice of innovation areas, is just around finding ways for what we share to be transferable and usable for other clinics and other settings. And I think that piece around working the scopes of practice, I think, can be something that is applicable there. In the second Brica group, we talked a little bit more around kind of actually the evaluation rubric and the challenges of the cross-disciplinary ways of evaluation of learners in the different settings, and the potential to involve patients in that rubric, and even how we can kind of offset those that have a little bit more time in the placements versus those that are in placements for shorter, and how we can be able to bridge that across the different disciplines. And then even talking about leadership styles, and understanding that across the team members, to see how they make decisions, and that be part of the onboarding as well.
Hi, yeah, we also had some really amazing suggestions, and some really thought-provoking comments that, were some things that I was like, aha, yeah, need to come on our list for things for the practice and innovation folks. The topics spanned the gamut. We had topics really around making sure that patients really felt they belonged in the clinic, really felt that they were part of the team, that they weren't just pieces of data that they had a strong voice, and we needed to make sure that we acknowledged that voice and we heard the voice. Also, that there is potentially some pitfalls if we are organize this to death, that we need to allow some time for room and for breathing and for things to happen naturally, to occur as well. And so just really, that was really like an aha moment for me to go, yes, that's amazing, we need to do that. We had questions around the attachment system, using AI, the referral system, how would we bring specialists in, co-visits, what does that mean in terms of having multiple practitioners and a patient, and some of the considerations that we need to pay attention to if we were to do that. Role clarity, we have lots of roles that have overlapping scopes, and so how do we clarify that for the team and for the clinicians and the learners, and make sure that we are building that safety net, but we're not building in that redundancy, we're not slowing down the system or hindering the system in any way. We had, how do we access different populations, those perhaps that are homebound or those who are marginalized populations who have a lot of historical trauma with the healthcare system? How are we going to access them and make sure that they feel an integral member of the team? Again, also another population could be those who are cognitively not able to understand the team-based care, and who could be their representation, making sure that their voice is truly heard at the table. Looking at how do we embed being proactive and health really being the focus, if we're longitudinal primary care, that health promotion, that wellness, how do we start with the initial visit really with that focus and really bringing in health and that preventative piece to help keep people as healthy as possible. One of the questions was around, have we thought about actually what does trust mean? And so looked at, what does trust mean for the patient with the clinic, but also between the team members, the clinicians, between the learners. We have lots of different dynamics at play here. And so looking at the different dynamics between trust, but also safety. What are the kind of the data points that we could look at to help support whether we are building trust or building safety? I think there was a few others, but those are the big ones. And I just wanted to say thank you, everybody, for your great ideas, and feel free to please keep sending them our way. We love to hear from you. And like I said, we're looking to figure out ways to, see what the issues are out there, test them out, and share the knowledge back to you.
Thank you, everybody. And thank you in particular to the facilitators for both sharing the highlights and facilitating each of the rooms and the dialogues today. Chen, do we have the word cloud to bring up to share? I'm really excited about this. I love seeing kind of what shows up from those. Thank you. Impressive. Oh, I have goosebumps. Can't wait to see 1 year out data, collaboration right up in the center. Shared accountability relationships, hopeful, potential, inspired, innovate, patient partnership, creativity, eagerness. Some concern about confusing and too much into policy academia. Curious about that. And maybe at this point, I'll invite Christy back to join us here. And we can bring everyone into the room. Excellent.
I have to agree that this was a lot of information. As I say, I just zipped in between the breakout rooms and it could seem a little bit, I think, like a fire hose. This project has been developing since 2020. I was invited to start the business plan and the proposal, and we did a bazillion town halls and wide engagement. And this is, like it's taken me so many years to develop this understanding of what our goal is, what we hope to achieve. And then we've just kind of thrown it all back at you right now. And so I understand it's confusing. It's going to take a bit. And it's going to be a little chaotic at the beginning. It's going to take some time to build these processes, and some of it we are trying to perhaps that sort of very process and academic oriented. It's just to try and set some guidelines to start on, recognizing that we can prepare as much as possible, but until we're actually all working together in the clinic, we're really kind of doing our best guesses for some of these things. So I think it's fair. I'm an optimistic, and it's going to be a lot of learning, and a lot of iterating. And so I'm really looking forward to it. And I really appreciate some of the really thoughtful comments and questions that came both in the chat in the breakouts and directly in the breakouts. So I appreciate that. And I really appreciate this group for bringing kind of that real world reality lens. We are fortunate to have that sort of protected time, this sort of controlled environment. And our hope is to take that real world information and be able to tinker with it, and then perhaps share out some ideas to help with challenges in the real world. I mean, that's ideally what we're aiming to achieve here. Yeah, so I've gone way off script with respect to what we were supposed to do here. But I really appreciate your time and your engagement in this conversation. And I look forward, please, if you haven't had a chance to enter feedback, please do. We will work on it as best we can, and we will bring back our learnings to this network as much as we can. And we're also going to continue to share other team-based care initiatives and their successes and challenges in future events. So watch your emails, because we will be circulating a save the date and an invite to the next event. And if you're not on the listserv, please either go to the webpage and sign up, or I was going to say it could be, the link might be put in the chat if Chen can find it, and post it up there. The link to the listserv. So anyway, I really appreciate everything. I'm going to give you back, unless there are any last minute, we missed something, and something that you really haven't heard in this closing discussion that you really need us to know and think about. By all means, raise your hand and let us know. Otherwise, I'm going to give you a few minutes of time back. And I really appreciate you sticking around this long and learning about this exciting project that we are embarking on.